Hello friends, today our topic of discussion is the HIV infection or also known as the AIDS. In this video, we will discuss about what is the difference between the HIV and the AIDS, its cause or the route of transmission, its sign and symptoms, and also discuss its latest updated management. Before starting our topic, my dear all friends, request you to subscribe my YouTube channel name is RM World of Medical Education because I need your love and support. Let's start our topic. What is HIV? HIV, also known as the human immunodeficiency virus, and it's a virus spread through the body fluids that affect the specific cells of the immune system known as CD4 cells or T cells. A virus that kills the body's CD4 cells or the T cells and damage the immune system. A virus that replicates inside the human body must invade a healthy cell in the body to survive. What's the AIDS? AIDS, also known as acquired immunodeficiency syndrome. AIDS is the late stage of HIV infection. Once diagnosed, the body has a hard time fighting disease and certain cancers. No cure for the AIDS, but there is a treatment. Why it is so important? About 1 in 4 new HIV infections in among youth aged between 13 to 24 years of the age. Most of them do not know they are infected, are not getting treated, and can unknowingly pass the virus on to the others. These are the simple questions to check your current knowledge of the HIV. Like, I can get HIV by being around the HIV positive people? No. If I am a HIV positive, now my life is over? False. I would not be able to tell if I or my partner was HIV positive. Yes, it's true. I am sexually active but don't inject the drugs, so I cannot get the HIV. No, I can get the HIV from all forms of the sex. True. I can't get HIV from the mosquitoes. True. My partner and I are both HIV positive, so there is no need to use a condom. It's false. How to diagnose the HIV? There are certain specific tests for the HIV infection like antigen detection, which is known as P24 antigen, viral load in the CD4 or the T4 count, antibody detection, number of white blood cells in the blood, viral load. Viral load means amount of the HIV in the blood. How the HIV is spread? HIV is passed from person to person through the exchange of the body fluids in the three ways. First one, unprotected sex with an HIV positive person, through the blood to blood contact, or through the exposure to the HIV before or during the birth or through the breastfeeding. What fluids can transmit the HIV infection? Like blood, semen, vaginal fluids, rectal fluids, breast milk, they are the source of transmission of the HIV infection. How does the HIV enter into body? HIV infection can enter into body through the mouth, through the vagina, nose, penis, eyes, anus, ears, or the open skin like the cuts and wounds. What are the symptoms of the HIV? Many people who are living with the HIV have no symptoms for around the 10 years or more, but The patient may present with muscle aches, chills, mouth ulcers, fever, sore throat, fatigue, night sweats, swollen lymph nodes, and the skin rashes. What is the window period? The period of a time after some may have been exposed to the HIV, but before a test can detect it, means up to the 3 months. The person becomes immediately infectious. The viral load and the CD4 count graph. This graph show the viral load in the HIV positive persons. Show either the patient is asymptomatic or the symptomatic or the patient having acute infection. What does an HIV test mean? The positive test means HIV antibody found. Have the HIV virus and can pass to the others. Need to begin the treatment immediately. And if it is negative, no HIV antibody found, may not have the HIV virus, so consider the window period. Retest in the 3 months. What's the HIV treatment? The treatment for HIV is called the antiretroviral therapy. Antiretroviral therapy involves taking a combination of HIV medicines called the HIV treatment regime every day. ART or the antiretroviral therapy is recommended for everyone who has HIV. Antiretroviral therapy cannot cure the HIV, but the HIV medicines help the people with the HIV live longer, healthier lives. What is the prevention? Using condoms or the barrier method. Ensuring that your partner who are living with the HIV are taking treatment. Using personal protective equipments to prevent getting HIV if you have ongoing risk including during the pregnancy. Using sterile needles, syringes for all the injections. Getting tested and treated for sexually transmitted infections. Please hit the button like if you like the video and give me a thumbs up. You can subscribe to my channel if you like what I do, and thank you so much for watching my video. Have a nice day.